We've all heard the saying, you are what you eat, but with rising obesity levels along with lifestyle-related disease, should the medical profession be considering it more? Sano School of Culinary Medicine combines food and health education in its range of evidence-based courses. We sent Robin Ross to the Sano restaurant in London to sort the facts from the fads.
Sano restaurant and cafe in London. Here you can dig into nutritious, healthy food, and it's needed. According to the Lancet Global, poor diet now generates more disease than physical inactivity, alcohol and smoking combined.
Despite government guidelines of 5 a day, just 1 in 5 of us are eating enough fruit and veg. As obesity rises, so does the rate of preventable diseases.
Dr. Asim Malhotra is a cardiologist and a professor of evidence-based medicine. He's on a mission to save lives, 1 million at a time.
The situation has become so dire with diet-related diseases such as obesity, type 2 diabetes and heart disease, putting so much strain on the NHS. But unless we tackle this head on, we as a nation and the future of our children is doomed.
To help educate more people on healthy eating, Sano School of Culinary Medicine was launched in 2016. The school offers evidence-based online nutrition education globally. One of its courses is to help medics on the front line. Dr. Claudia Pastidis only touched on the science of nutrition at medical school, not how to use it, so she embarked on one of the courses to fill in the gaps.
I only ever really knew the basic science. I never knew how to apply it to the patient directly. So there's quite a lot that I learned in the diabetes chapter that made me think, actually, if I'd known that I could apply this and revisited this after finishing my studies, it would have been really useful because then I could offer more holistic care to my patients and not just focusing on the pharmacology.
Heather is a nutritional therapist. She and her husband Doug set up Sano School Restaurant and Cafe. They want to reverse the severe growth in lifestyle diseases and believe if medics were educated in nutrition, they could really make a difference, even in a 10-minute consultation, by sharing their knowledge and empowering patients to take back control of their own health.
Obviously, we're not expecting people to give a full nutritional consultation, but in 10 minutes you can, and our course, we actually teach you how to do that. So we're showing you which bits of information and how to put them to the patient to give them some base knowledge and then to teach you how to signpost to other sources for that patient.
Currently, there is no formal medical training on the impact of nutrition on health, which means doctors are not empowered to actually treat patients with diet and lifestyle related diseases that are causing tremendous harm to their health.
There are 3 courses. They teach practical skills, such as how to share nutritional information within consultations and recipe development. The courses are for people interested in nutrition for their businesses, but are also for anyone wanting to understand nutrition at a more detailed level in their own time. Claudia works part-time and is a mum of 3.
I could do a little bit in the evenings, I could do a little bit in the middle of the day if I wanted. It's very accessible, really easy, on my laptop. It was very interactive and really nicely written as well, so it didn't feel like a chore, actually. It was fun and it was interesting to do, so it was great.
What we need to do is get back to more traditional ways of eating. And the ethos of Sano, for example, that promotes cooking, good nutrition, food education, that needs to be widespread.
But can the medical profession be persuaded?
There are some that are sceptical, but actually the younger generation, they are really, really interested in nutrition. They're not taught it at medical school in any great depth, and they see this as a lifestyle change, and they really want to be able to help their patients with it.
And your husband's a surgeon and you've managed to persuade him. No mean feat.
Yes, I had to persuade him. It was difficult, it wasn't easy, but actually with making some changes to what we're eating and encouraging him to look at the nutrition behind everything that he does and was putting in his mouth every day. And he's lost quite a lot of weight, and actually I think he's sold on the idea, definitely.